This is Hyung Jun Park from Boramae Hospital. I will present clinical outcomes after TKA evaluated by growth finding and spasticity. I declare that there is no COI. Recently, spasticity was used in the orthopedic field. Bone trace uptake and spasticity increased according to the cartilage region. Also, it can detect the region before structural changes were found. So we thought that spasticity could be used before TKA. We wanted to determine whether spasticity reflected the cartilage region underneath patella. Also wanted to determine the outcomes evaluated by growth finding and spasticity. We found a patient who underwent primary TKA without patellar resurfacing. Among them, we enrolled 206 cases. PS-type patella-friendly designed femoral implant was used in all cases. Femoral component rotation was decided considering transepicondylar axis and white side line. Patella was managed carefully as follows. Spasticity was graded into 4 if bone trace uptake was equivalent to normal cancellous bone graded as 0, and similar to the articular surface graded as 2, and if it was higher than articular surface graded as 3. ISTA's grading system was used intraoperatively. Fellows Patellar score and Boramae score was used. MCID in Boramae score was set according to the study of Clement. Radiographic evaluation was done using 2 indexes. There is no difference in baseline characteristics. We found that bone trace uptake and ICRS was related to each other. The observation that denuded patella has high bone trace uptake was 5.89. According to ICRS, there is no difference in clinical outcomes and radiographic indexes 2 years after TKA. According to spasticity, there is one thing that high uptake group shows worse clinical outcomes in Boramae stiffness score 2 years after TKA. The difference was 6.25% when it was translated into percentage. However, it didn't have clinical meaningfulness. In conclusion, bone trace uptake increased according to the degree of patellar cartilage degeneration. However, visual assessment and spasticity could not predict the early postoperative outcome after TKA without patellar resurfacing. Thank you for your attention.